Circumcision is a surgical procedure to remove the extra skin, known as the foreskin, that covers the end of the penis. Circumcisions for newborns can be performed in our doctor's office or in the hospital nursery. If your child is older than 2 months of age or greater than 10 pounds, the procedure will need to be performed in the operating room with general anesthesia. The benefits of circumcision are a reduction in the risk of UTIs or urinary tract infections and an infection of the foreskin. A circumcision also reduces the lifetime risk of penile cancer and eliminates the risk of phimosis, which is the inability to retract the foreskin.
For newborn circumcisions, we use the Plastibell technique. Your baby will be awake during the procedure and receive an injection of numbing medication at the base of the penis. He will feel only the poke from a very small needle. Once the area is numb, a Plastibell device will be used to clamp and remove the extra foreskin. Your family will be asked to wait in the waiting room during the 10 to 15 minutes it will take to complete the circumcision. During the procedure, your baby will be swaddled and offered simple sugar by an assistant. Once the procedure is completed, you can return to the room to comfort your baby. You will be asked to wait in the room for approximately 10 minutes so your baby's bleeding can be monitored. He will be rechecked by a team member before you leave.
After the procedure, the head of your baby's penis will have a plastic ring and tie around it that will fall off on its own in about 1 week. The procedure is safe and carries a low risk of bleeding and infection. The most common complication is an incomplete circumcision, where not enough foreskin is removed. In addition to cosmetic issues, this can lead to adhesions, which are scar tissue that forms between the foreskin and the head of the penis, as well as irritation and infection. For these reasons, your baby may require a surgical revision when he is older.
Circumcisions are easy to care for. You can change your son's diaper normally and use baby wipes or other routine hygiene techniques. We recommend avoiding submerging the penis underwater for the first 2 days after the procedure to allow the edge of the skin time to heal. After 2 days, you may resume bathing your son normally. If you find that his penis is sticking to the diaper, you can use a petroleum-based ointment like Vaseline, Aquaphor, A&D, or bacitracin applied directly to the head of his penis or smeared on the front of your son's diaper.
The procedure is well tolerated in newborns with minimal discomfort. If you notice that your son appears uncomfortable or unable to be settled after diaper changes, you may give him over-the-counter infant's Tylenol. The provider will advise you on the correct dose for your son based on his weight. You can give the Tylenol every 6 hours as needed. Your son should not need Tylenol for more than 1 to 2 days after the procedure. The Plastibell will separate from the penis and fall off on its own in about 1 week as things heal. After the procedure, redness and swelling are expected. It will look like an angry bee sting. You will notice that the redness and swelling gets worse around days 5 to 7 as the Plastibell starts to work its way off. It is also normal for the head of the penis to develop a yellow film over it. These are all expected during the healing process and do not cause any added discomfort for your son.
Once the Plastibell starts to separate, it sometimes takes a couple of days before it totally detaches. This is normal. You should just continue with regular diaper changes and allow it to separate on its own. After the plastic ring falls off, it will take another week or so for all the redness and swelling to resolve. Once everything's healed, it is important to pull back on the remaining foreskin routinely with bathing to prevent the skin from sticking to the head of the penis. We do not require a specific follow-up appointment with our pediatric surgery team. Your pediatrician will check on the circumcision at your routine appointments. You will also be provided with our team's contact information, but we recommend using the AdventHealth app for any questions or concerns. It is the quickest and easiest way to communicate with our team. You can send messages and pictures directly to myself and my partner, which we can respond to in a timely manner.
At your visit, we will provide you with information on setting up the AdventHealth app on your phone. Please let us know if your son experiences a fever over 100.5 degrees, uncontrolled bleeding, severe pain that does not get better with medication, redness that spreads from the penis, pus-like drainage or foul-smelling odor from the penis, or if the head of his penis turns blue or black. Also, let us know if the plastic ring falls off in less than 2 days or stays on more than 14 days. Thank you for allowing us to care for your son. Please reach out if you have any questions. You may call our office at 813-756-1760 if you would like to schedule a newborn circumcision with our team.